Welcome back to the Vital Signpost. I think it's safe to say, as nurses, we encounter a lot of different medications, and really understanding their effects is crucial, especially those that affect, the central nervous system.
Oh, absolutely.
In this deep dive, we're going to explore sedatives and hypnotics.
Yeah.
We'll unpack how they work, their clinical uses, and those really important nursing considerations.
It's a topic that's definitely clinically relevant for us,
Mm,
but also has a personal impact,
mhm.
especially as we age and our sleep patterns change naturally. Understanding these medications can help us in our practice,
Right,
but also make good decisions about our own sleep health.
for sure. And before we, delve into the specifics of these medications, let's just take a step back and think about sleep itself. It's not just rest, is it?
No, it's not. It's actually a very dynamic and complex process that affects our physical and, cognitive well-being.
Hmm.
Sleep is a transient, reversible, and periodic state of rest. Transient meaning it comes and goes, reversible because we can wake up, and
Wow.
periodic it happens in cycles. During sleep, our physical activity and consciousness are reduced.
Hmm.
It's essential to understand the cyclical nature and, the specific stages of sleep to really get how different medications affect our sleep patterns.
Yeah, that makes sense. It's interesting that sleep isn't just one block of time, right?
Right.
There are
Right.
different stages in the sleep cycle, each with their own characteristics and functions. Can you guide us through those stages?
Sure. So we can categorize sleep into two main states, non-REM and REM sleep.
Okay.
Non-REM stands for non-rapid eye movement, and it's divided into four stages. Stage one is when you're dozing off, easily awakened, with slow eye movements.
Mm-hmm.
Stage two is deeper sleep, where it takes more to wake you up.
Right.
Stages three and four, this is what we consider deep sleep, also known as slow wave sleep.
Mm-hmm.
It's hard to wake someone up during these stages, and their heart rate, breathing, all that slows down.
Yeah, it's that feeling when someone tries to wake you up and you're just completely disoriented.
Exactly.
And then there's REM sleep.
Right, REM sleep with rapid eye movements.
Yeah.
During this stage, the brain is much more active, we have vivid dreams, and breathing can be irregular. Each of these sleep stages, non-REM and REM, is super important for rest and restoration, but medications can affect them differently.
I see. And manipulating those stages can affect how rested we feel, right?
Definitely.
Some meds might help us fall asleep faster, but then disrupt the later stages, so we wake up groggy.
Exactly. Understanding these stages is key to managing sleep disorders and choosing the right medication. For example, REM sleep is really important for our brain, for memory.
Hmm.
Disrupting it can make you tired and foggy during the day, even if you technically got enough sleep. And unfortunately, this is something we see with some medications.
Let's talk about medications designed to influence sleep. There's been a shift in what doctors prescribe, right?
Yeah, there has.
Moving away from some older medications to newer ones that work differently.
That's right. Benzodiazepines used to be the main choice for sleep problems.
Mm-hmm.
But now we see more non-benzodiazepines like zolpidem, azopiclone, and zaleplon. This shows that we're always looking for drugs that target sleep more precisely, with fewer side effects and risks.
Okay, so those are the non-benzodiazepines. Let's go back a bit and talk about those 5 main benzodiazepines used for sleep.
Okay, sure. We can group them by how long they last in the body, their duration of action. There are long-acting ones, intermediate-acting, and short-acting.
Right.
Long-acting ones are clonazepam, diazepam, and flurazepam. Intermediate-acting include alprazolam, lorazepam, and temazepam. And the short-acting group is triazolam, oxazepam, and midazolam.
That's a lot of options, each with their own characteristics and things to consider.
Exactly. And while they can be effective for sleep disorders and anxiety, it's crucial to remember the potential risks and safety concerns, especially with long-term use.
You're right. Recently, there have been black box warnings, both for benzodiazepines and non-benzodiazepines, showing the potential for adverse effects and reminding us to be careful when prescribing or giving these medications.
Yes, in 2019, there was a warning about complex sleep behaviors while on these drugs.
I see.
This means things like sleepwalking, eating, even driving, all while not fully awake. These can have serious consequences, so it's essential to understand these risks.
It's a reminder that even commonly prescribed medications have risks. There was another warning for all benzodiazepines too, right?
Yes, in 2020, the FDA issued a warning about potential abuse, misuse, addiction, physical dependence, and withdrawal symptoms with benzodiazepines.
Wow.
This emphasizes the importance of choosing the right patient, educating them about the risks, and watching for signs of tolerance and dependence.
Mm-hmm.
These medications should be used carefully and only under the guidance of a healthcare provider.
So it's about balancing the benefits with the very real risks. Now let's talk about a couple of different hypnotic medications, ones that aren't benzodiazepines or non-benzodiazepines. Remeltein is one. It works differently from other sleep medications.
Yes, it does. Unlike benzodiazepines and non-benzodiazepines, Remeltein doesn't depress the central nervous system.
Oh, okay.
Instead, it acts like melatonin, a hormone that regulates our sleep-wake cycle.
So it works more with the body's natural sleep system, not by suppressing brain activity.
Yeah.
That's interesting. You also mentioned a new class of drugs, or orexin receptor antagonists.
Right.
What are they? What makes them unique?
The first drug in this class is suvorexant. It targets the orexin system in the brain. Orexins are neuropeptides, basically chemical messengers that keep us awake. Suvorexant blocks their action, making it easier to sleep.
So instead of suppressing the brain, it blocks those stay-awake signals.
Exactly. A more targeted approach.
Yeah.
Now let's get into how these drugs work at a molecular level. Focusing on benzodiazepines, their ability to calm the central nervous system comes from their interaction with specific receptors in the brain.
So they're not just randomly suppressing brain activity.
No, they have specific targets.
They influence the neurochemicals involved in sleep and wakefulness.
Exactly. These receptors are mainly linked to GABA, gamma-aminobutyric acid.
Uh-huh.
GABA is the main inhibitory neurotransmitter, meaning it calms the brain down, prevents overstimulation. Think of it as the brain's brake pedal.
I like that. So benzodiazepines enhance GABA's effects at these receptors, leading to that calming effect on the central nervous system.
Precisely, like turning up the volume on the brain's chill signals. And this is what allows benzodiazepines to have such a wide range of uses, not just for inducing sleep, but also for sedation, anxiety relief, muscle relaxation, even managing seizures.
Wow. One class of drugs with so many uses. But as we said, there are contraindications and adverse effects to consider.
Of course.
We need to be aware of these to ensure safe and effective use.
Absolutely. Benzodiazepines are generally contraindicated if someone is allergic, has a narrow-angle glaucoma, or is pregnant.
Okay.
They can be effective when used correctly, but there are potential side effects we need to watch out for.
And those are often related to their central nervous system depressant actions, right?
Precisely. Common ones include headache, drowsiness, paradoxical excitement, dizziness, cognitive impairment, and lethargy.
And we can't forget the risk of falls, especially in older adults who might already have balance or mobility issues.
Absolutely. Because benzodiazepines make you drowsy, there's a higher risk of falls, especially in our older patients. We need to start with the lowest effective dose and watch for any signs of dizziness or unsteadiness.
And what about that hangover effect? Patients feeling sleepy or groggy the next day, even after a full night's sleep.
Yes, the hangover effect. It happens because of the medication's lingering effects. It's important to tell patients they might need to adjust their schedule based on how they feel the morning after taking a benzodiazepine.
So it's about setting realistic expectations and managing those side effects. Now, let's talk about toxicity and overdose with benzodiazepines. What happens in an overdose, and how do we manage that?
Okay. Overdose symptoms can be things like sleepiness, confusion, reduced reflexes, even coma in severe cases. Luckily, an overdose of just benzodiazepines rarely leads to really serious problems like severe low blood pressure and slowed breathing, unless it's combined with other central nervous system depressants like alcohol. That's when it can become very dangerous.
So that's crucial for us to be aware of the potential for dangerous interactions.
Absolutely.
It's important to check for polypharmacy, especially with medications that have central nervous system depressant effects.
For sure. And if we do encounter a benzodiazepine overdose, we have an antidote called flumazenol.
Okay.
It competes for the same GABA receptors that benzodiazepines bind to, essentially reversing their effects.
So it targets the specific way the benzodiazepine works. But it seems like prevention and careful monitoring are still the best ways to avoid overdose situations.
Absolutely. Being proactive, doing thorough assessments, and being vigilant are the best ways to ensure safe medication use. Now, before we move on to barbiturates and those over-the-counter sleep aids, I think it's important to talk about non-pharmacological interventions for sleep. We've talked a lot about medications,
Right.
but it's always crucial to try those non-drug options first. They can be very effective for better sleep and less reliance on medication, which fits with our goal of patient-centered care.
I totally agree. Medication should always be a last resort after trying those non-pharmacological strategies. Can you give us some examples and how we can use them in our practice?
Yeah, definitely. So one of the most effective and often overlooked is a regular sleep schedule. Going to bed and waking up around the same time each day, even on weekends, can make a big difference.
Yeah, that consistency is so important.
It is. It helps regulate your body's natural sleep-wake cycle, what we call the circadian rhythm. It's like our internal clock.
Right, like setting a timer for our sleep. And we can encourage our patients to do this too, right?
Absolutely, even in the hospital where routines are often disrupted.
That makes sense.
Another good strategy is a relaxing bedtime routine. A warm bath, reading, calming music, or relaxation techniques like deep breathing or meditation.
Yeah, I like that. It's about winding down and signaling to your body that it's time to sleep.
Exactly, and creating those positive associations with bedtime.
Right, those pre-sleep rituals. We can incorporate this into our care plans too, right? Tailoring it to each patient.
Absolutely. And the sleep environment is crucial too. Dark, quiet, and cool. Minimizing bright lights, especially from electronics, before bed can really help.
It's about making the bedroom a haven for sleep. And we can't forget about lifestyle factors either.
You're right. Regular exercise is important for overall health and sleep. But not too close to bedtime? That can make it harder to fall asleep.
Right, finding that balance. And diet plays a role too, doesn't it?
Absolutely. Limiting caffeine and alcohol, especially in the evening, is key. Caffeine keeps you awake, and alcohol, while it might make you sleepy at first, disrupts sleep later in the night.
So many things we don't even realize are affecting our sleep.
Ah,
Okay, let's shift back to those sedative hypnotic medications.
okay.
What are the key things to focus on when assessing a patient who might be taking these medications?
Well, before giving any sedative hypnotic, a thorough patient assessment is crucial. We need a detailed look at their sleep patterns. Don't just ask, are you having trouble sleeping? Get specific. What time do they go to bed? How long does it take to fall asleep? Waking up during the night? Quality of sleep.
Right, getting a full picture of their sleep, not just focusing on insomnia.
Exactly. Also, ask about any non-drug things they've tried for better sleep. Helps us tailor our approach and avoid unnecessary medications.
That makes sense, building on what they're already doing.
Exactly. We need a complete health history, too. Allergies, medical conditions, current medications. This is super important with sedative hypnotics because of their potential interactions.
Yeah.
Pay attention to their alcohol, nicotine, and caffeine use. These can affect sleep a lot.
Right, especially those other central nervous system depressants.
Yes, combining those can be dangerous. Don't forget to check their vital signs, especially blood pressure, both lying down and standing up. Sedative hypnotics can cause orthostatic hypotension.
Right, a drop in blood pressure when standing.
Increases the risk of falls.
So we should check for that, especially in older patients.
Absolutely. And a neurological assessment is essential. Mental status, memory, orientation, mood. Changes here could mean side effects from the medication.
It's about having a baseline and watching for any subtle changes.
Precisely. And we need to consider those cautions and contraindications, things that might increase the risks with these medications. For example, benzodiazepines and those similar drugs are generally not good for patients with allergies to them, narrow-angle glaucoma, or during pregnancy.
Right.
Also use them very carefully with patients who have breathing problems, liver or kidney disease, or a history of substance abuse.
So we have to be extra careful with those higher risk patients.
Absolutely. And remember, older adults are generally more sensitive to these drugs, so lower doses are often needed.
So individualizing care is key.
Definitely.
Okay. Once we've assessed and decided a sedative hypnotic is right, what are some important things to remember during administration and monitoring?
Safety comes first. These medications can cause sedation and ataxia.
Right, meaning impaired coordination.
Exactly. So prevent falls, use bed alarms, side rails, help patients walk, especially in the hospital where they might be unfamiliar with their surroundings.
It's about making the environment safe, especially for those more likely to fall.
Yes. We also need to teach patients about drug interactions. As we talked about, mixing sedative hypnotics with other CNS depressants like alcohol, opioids, or even some over-the-counter drugs can have serious, even fatal consequences.
Right, patient education is so important here.
Absolutely.
And what else should we emphasize during those teaching sessions? It's not just about the risks, but empowering patients to use these medications wisely.
You're right. We need to encourage them to take these medications only as prescribed, not exceeding the dose. Emphasize avoiding alcohol and other CNS depressants while taking these meds. And remind them never to share their medication with anyone else.
Really important points.
Yeah.
And it's often during those medication moments that we have those opportunities for teaching.
Exactly. We also need to educate them about dependence and withdrawal symptoms.
Hmm.
While these are less common with non-benzodiazepines, they are still risks. We don't want patients to become reliant on these drugs for sleep. And speaking of sleep, let's talk about REM interference and rebound insomnia.
Yes, let's break those down. What is REM interference and why is it a concern? We talked about the importance of REM sleep, but let's revisit that in the context of medication.
Okay, so REM sleep is the stage with rapid eye movements, vivid dreams, and more brain activity. It's crucial for our brain and emotions. Some sedative-hypnotics, especially benzodiazepines, can suppress REM sleep. This might not be obvious at first, but long-term suppression can cause fatigue, difficulty thinking, and even mood problems.
So even if they're getting enough sleep, it's not good sleep if REM is being disrupted.
Exactly. And then there's rebound insomnia. This is when someone stops taking a sedative hypnotic suddenly and their insomnia comes back, often worse than before.
So it's like the body overreacts when the medication is stopped.
Right. It reminds us these medications should be used for a short time. And tapering off slowly is important. It's about letting the body adjust to natural sleep, not becoming dependent on the medication.
Yeah, makes sense. So any specific considerations for different types of sedative hypnotics? We've talked about some general principles, but what about the unique nuances of each medication?
Yes, each one has its own characteristics. Understanding those can help us provide better care. When giving benzodiazepines, remember they take a while to kick in, usually 30 minutes to an hour.
Mm-hmm.
So give them well before bedtime. We want it working when they're ready to sleep, not hours later, disrupting their sleep cycle.
It's all about timing. What about those IV benzodiazepines?
Those need extra caution. Dilute them properly and administer slowly. This helps prevent problems with breathing and blood pressure. Monitor their vitals closely during and after giving the medication, especially their breathing and blood pressure.
They need our full attention. What about non-benzodiazepines? Anything specific there?
Non-benzodiazepines, like zolpidem, work faster than benzodiazepines. This is good for those who have trouble falling asleep, but it means they need to take it right before bed. No reading or TV after taking the pill.
Got it. And we need to remind them about those complex sleep behaviors, right?
Yes, absolutely. Things like sleepwalking, even driving while not fully awake can happen with these medications.
It's like they're asleep, but their mind is partly awake.
Exactly. Educating patients and families about this is very important. They may need to take extra safety measures at home, like locking up the kitchen or keeping car keys away from the bedroom.
Now, what about muscle relaxants?
Right.
They can cause sedation, but what else is important to remember when caring for patients on these?
Muscle relaxants target muscles, but we need to be aware of their effects on the central nervous system. Watch for drowsiness, dizziness, problems with coordination, and changes in vital signs.
So check their level of consciousness, breathing, and blood pressure regularly.
Yes.
And tell them to change positions slowly. Also, no driving or operating machinery. Safety first.
Absolutely. And over-the-counter sleep aids, although easily available, we need to advise patients about possible interactions with other medications and discourage long-term use.
They might seem harmless, but they can cause problems if not used correctly.
Exactly. As with all medications, educating our patients is crucial. We empower them to make informed decisions about their health and to use these medications safely. It's not just about giving pills. It's about advocating for our patients, educating them, watching for problems, and making sure they have the knowledge and support to manage their sleep well.
This has been a really thorough look at the important things to consider when dealing with sedative hypnotics.
Yes.
We talked about patient assessment, safety, and education.
All very important.
And I think this sets us up well for some case studies and critical thinking exercises.
I agree. Let's test our knowledge and see how we apply these concepts in real-life situations.
Looking forward to it. We'll see you back here for part 3. Welcome back to the Vital Signpost. We've learned so much about sedatives and hypnotics in this deep dive.
We have. Their different classes, how they work, and the crucial nursing considerations to use them safely and effectively.
Yeah, a really comprehensive journey. So in this last segment, let's put our knowledge to the test. What do you think?
Sounds good to me. Let's try some real-world scenarios and review questions, the kind of things that come up on exams, you know?
Exactly. Sharpen those critical thinking skills.
Yeah.
See how these concepts apply to real clinical challenges. ready for the challenge.
Oh, absolutely. I have a scenario in mind that really shows how important it is to recognize the signs and symptoms of a benzodiazepine overdose and what to do about it. Imagine you're on the night shift in the ER, and an ambulance brings in a patient, a middle-aged man found unresponsive at home. His wife tells you he has anxiety and insomnia, has been taking a benzodiazepine for years. You assess him drowsy, but you can rouse him. Vitals are stable, but his breathing is shallow and a bit depressed. What immediate intervention would you expect?
Okay, let's think. Benzodiazepines suppress the central nervous system, right?
Right.
So an overdose would make those effects worse, potentially leading to respiratory depression, even coma if we don't act quickly.
Right.
We need to reverse those effects. So maybe hemodialysis, flumazenil, naloxone, or intubation and mechanical ventilation.
Okay, those are all possibilities, but we need to choose the best one based on how the patient's presenting and the situation. Hemodialysis is usually for very severe cases when the drug is hard to remove otherwise and there's organ damage. Naloxone is for opioid overdoses, not this. Intubation and mechanical ventilation might be needed if his breathing gets much worse, but not our first choice.
So that leaves flumazenil.
Right.
It's a benzodiazepine receptor antagonist, so it competes with the benzodiazepine, basically reversing its effects. It targets how the benzodiazepine works.
Exactly. Giving flumazenil intravenously would be the most appropriate first step to counteract the overdose. Then we'd closely monitor his breathing, how awake he is, and his vitals, and be ready to escalate care if needed.
This really shows how important it is for nurses to know how to spot and respond to overdoses.
It is.
Those quick assessments, knowing the antidotes, anticipating complications can make a big difference.
Absolutely. Let's try another scenario. This one highlights how important patient education is and those paradoxical reactions to benzodiazepines. Let's say you're caring for an older patient prescribed a benzodiazepine to help him fall asleep.
Okay.
But the night nurse tells you the patient was up most of the night, watching TV, reading in bed. How would you document this reaction to the medication? Allergic reaction, teratogenic reaction, paradoxical reaction, idiopathic reaction.
This is a classic paradoxical reaction,
Yes.
right? The medication does the opposite of what we expect. Instead of sedation, they get insomnia and agitation. Documenting it as a paradoxical reaction is key so the whole team understands and we can make good decisions about treatment moving forward.
Exactly. An allergic reaction is an immune response, a teratogenic reaction affects a fetus, and idiopathic means we don't know the cause. Here, we see a clear link between the medication and these odd symptoms.
Makes sense.
So it's a paradoxical reaction.
This shows how important it is to watch for unexpected reactions to meds, especially in older adults. They can be more sensitive to these kinds of adverse effects.
Absolutely. Now let's talk about suvorexant, that orexin receptor antagonist we mentioned.
Yeah.
What are the key things to teach a patient starting this medication for insomnia?
Well, suvorexant is relatively new,
It is.
so patients might not be as familiar with it as the older sleep meds.
Right.
We need to give clear, simple info about how to take it, side effects, and any precautions.
Great points. Timing is important. Suvorexant should be taken about 30 minutes before bed.
Right. Not like some others you take right before lying down.
Exactly.
Yeah.
That gives it time to start working as they're getting ready for bed.
Mm-hmm.
We should also talk about the possibility of drowsiness the next day and those unconscious nighttime behaviors.
Right, because even though it's not a central nervous system depressant in the same way as benzodiazepines, it can still have those lingering effects.
Exactly. And those nighttime behaviors can be really worrying. Sleepwalking, eating, even driving while not fully awake. These can have serious consequences.
Absolutely. We need to make sure patients and their families understand these risks so they can take precautions.
Yes, making the environment safe. Okay, moving on to muscle relaxants. What's the main adverse effect to monitor for in a patient taking a muscle relaxant? Central nervous system depression, hypertension, peripheral edema, blurred vision.
Muscle relaxants work on muscles, but it's their central nervous system effects that we really worry about.
Right.
We need to watch for signs of CNS depression, drowsiness, dizziness, problems with coordination, even breathing problems in severe cases.
Exactly. Hypertension, edema, and blurred vision can be side effects of some drugs, but not typically with muscle relaxants. We should focus on those CNS effects and minimize the risks.
It's a reminder that meds can have effects beyond the system they're targeting.
They can.
Okay, last scenario. You're a nurse on the night shift, busy med-surg unit. You have a patient with insomnia, anxious about a procedure, can't relax. What would you do first?
Give a sedative-hypnotic if ordered. Offer them tea with valerian. Encourage them to walk if they can. Focus on a restful environment and reduce noise.
Ah, classic nursing challenge. Insomnia in the hospital. We want to promote sleep without drugs first, reserving medications for when those strategies don't work.
So a sedative hypnotic might be an option, but not the first choice. What about that valerian tea?
Well, we don't know for sure how effective valerian is, and it can interact with other medications, so be careful with that. Walking is great for sleep long term,
Mm-hmm.
but
Yeah.
not practical for a patient who's anxious, tired, and maybe hooked up to machines.
Yeah.
So that leaves making the environment better for sleep.
Exactly. Dim the lights, reduce noise, adjust the temperature, and try to do all our nursing care at once to avoid waking them up.
Yes, those simple things can really help.
It's about recognizing that sleep is vital for healing.
And as nurses, we need to advocate for our patients' sleep, both through what we do and by teaching them good sleep habits.
Right. Now, our last question. Let's talk about benzodiazepines again. What are some key things to keep in mind when giving a benzodiazepine for sleep?
Safety and education are always key. We need to make sure people understand that benzodiazepines aren't meant for long-term use.
Right.
Short-term use helps avoid tolerance, dependence, and withdrawal.
Exactly. And that delayed onset of action, give the dose about an hour before bed so it starts working when they're ready to sleep.
And remind them about possible hangover effects the next morning.
Yes, important for safety.
So this deep dive has been a fascinating exploration of sedatives and hypnotics,
It has. We've covered a lot.
their pharmacology, clinical uses, and those important nursing considerations.
I think our listeners are well equipped to provide excellent care to their patients and to prioritize sleep health for themselves as well.
Sleep is so important for all of us. Let's make it a priority. Until next time, this is the Vital Signpost, signing off.